Hello everyone, I'm Leslie Cornwell, Certified Nurse Midwife with Empowering Midwifery Education. This section has to do with non-hormonal contraception. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. Content not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local unique situation. The course objectives, the students will be able to verbalize the importance as midwives understanding contraception options and giving advocacy to our clients for their choices. They'll be able to verbalize what contraceptions are, particularly non-hormonal contraceptives, since that's this section. They'll be able to talk about the mechanism of action and the effective rate of non-hormonal contraceptions, and then they'll be able to verbalize with their clients the risk and benefits of the different options with non-hormonal contraceptives. This topic is really important for midwives because most of our clients, particularly community-based home birth center midwives, our clients don't want hormones. They want more natural. They want not the traditional medical route of contraception. So we're far more popular with diaphragms, natural family planning, Paraguards, condoms, cervical caps. Spermicides are a much more common option for the clientele that we support compared to the traditional hospital system where it tends to be more birth control pills and Mirena and Skylas and Nexplanon because it's a hormone, it's low key, it's low maintenance. So we want to be able to advocate and talk extensively about permanent options and non-permanent options and hormonal options and non-hormonal options as midwives with our clients. So let's go to the basics. What are contraceptions? Contraceptions are a method of preventing pregnancy. It could be in a form of implants, injectables, patches, rings, IUDs, condoms, sterilization, breastfeeding, natural family planning, fertility awareness, barrier methods. The list goes on and on and on and on. And each one has a different mechanism of action, how it stops pregnancy from occurring, and how effective each one is at causing that prevention to happen with the pregnancy. So there is a measure of effectiveness with a certain percentage of out of how many women. So if they say 92% effective, 92 out of 100 women will not get pregnant, 8 will. And so if they say 99% effective, then 99 out of 100 women will not get pregnant. So these are really important concepts. Nothing is ever 100%. We could say 99.999 because like the sterilizations, the Nexplanons, there's much more secure, lower risk, but the only 100% option is abstinence. And I joke, but I don't joke. I know very few people that that's the route that they would choose. I don't know anybody. So we definitely need to be able to talk with our families after the baby comes. What are the different options available? So what are the different non-hormonal contraceptions? These are the ones that we're familiar with in the United States. They don't have any hormones in them. They're either causing a barrier for the sperm to not get to the egg, or it's causing a hostile environment where, like for example, an IUD, a Paraguard, is lined in copper. It's acidic, the sperm can't live to get to the egg. Or we're flat out just creating a barrier where the sperm can't get there by withdrawal methods so that the penis is being pulled out of the vagina before ejaculation occurs. We have condoms that if there is ejaculation, it can't go past the barrier. Natural family planning is avoiding the ovulation time when a woman can get pregnant and not having sex at that time. So there's a lot of different things out there. IUDs are traditionally placed by certified nurse midwives and by physicians, but it's something that I think as certified professional midwives and community-based midwives, they should at least understand it so that you can educate your families and just refer them to the specialist that inserts it if you don't directly do that. So it's a small T-shaped device that's placed within the uterus. Those two T-shaped prongs at the top are actually folded into the insertion tubing. So it's one flat rod until it's inside the uterus, and then that's what keeps it into place until it's ready to be removed. The string at the bottom, the clients will be able to feel. You would teach them how to feel it, and then that's what's used to remove the IUD when the client is ready. An IUD with the Paraguard, the copper, is good for up to 10 years, and then there are ones with low dose progesterone and estrogen components with the Mirena that are out there, and then they can range from 5 years to 8 years being in place. But we're focusing right now on the Paraguards lined in copper. It makes it an acidic and a hostile environment so that the sperm can't live expensive to get to the egg, and it's 99% effective. It's a great option that a lot of particularly religious groups, where they want low maintenance, they want high effective rate, and they don't want people to know they have it. So it's interesting to me that it's a great option if you don't want hormones in your body, you want to know your cycle, you want protection that's low maintenance, but you also don't want all these other barriers in place and risks. So the one thing to think about with the IUD, the Paragard, is if they have a history of heavier periods. Because it's a foreign object inside the uterus, it can make the periods heavier and more cramps. So people that have had a history of really painful periods and really heavy periods, this tends to not be a good option for them, but it's just a choice to discuss. So here's a great picture of one. This is officially the copper. It's really small. It's like 2 inches, and it's super easy to place. It's super easy to remove, especially after they've had a baby before and their cervix has been open. It's a really good, effective option for someone wanting a long-term choice of birth control. So there's the copper. It makes it, the mucus is more thick. It makes it so it's an acidic, hostile environment. It damages the sperm on a core level. The copper is really an important component. Some people, fine. I've had a couple people get acne and weird side effects and reactions to their body from having a Paragard, but most people do really, really well with it. The next option are barrier methods. So the diaphragms, the condoms, the cervical caps, and it's really creating, when there is ejaculation, the sperm can't get to the egg. So you want to make sure you have something that's fit the right size. So diaphragm fittings are interesting because most obstetricians don't know how to do it anymore. It's more of the community-based natural setting that picks diaphragms still. So especially as midwives in community and doing clinics, you're going to get asked to do diaphragm fittings because each woman's pelvic tone and her weight and her size, you have to get the right size diaphragm fit so you don't have any gaps where the sperm can get through. And the cervical cap is that similar concept. So it's a rubber. She inserts it. She keeps it in for a few hours after. You can add the spermicide in addition to the barrier to just increase the effectiveness rate. The sponge method, it's not as popular anymore. I can't even think of a lady that I've prescribed it for. It was very popular in the 90s. It's just another barrier method that can be removed up to 24 hours, and it can be left in for at least 6 hours after intercourse, just because sperm can live for a couple days and you don't want to remove a barrier method, and then the sperm will still swim up into the cervix and get to the egg that could be potentially ovulating. So it has a higher fail rate. For a woman that's never had a baby before, it's about 14%, which to me, that's pretty high. I don't know too many people that would be okay with that. And then if you've had a baby before, it's drastically higher, 27%. So that's part of why it's just not a popular one that's talked about anymore, because we have so many options. With oral contraceptions are 92 to 99%, depending on how well they take the pills, and IUDs and Nexplanons and all these other barrier options that are out there that are far more effective now. Condom is a more common one for teenagers, people that don't go in and get an evaluation. You can just buy it over the counter. You don't need a prescription. They're very cost effective, but then you got to make sure, there's different sizes. There's latex, there's non-latex, there's spermicides, there's non-spermicides. And what do you do if the condom breaks? And then you got to worry about the day after pill and more aggressive hormones if your barrier method with them is an issue. There are some that are animal skin, but they don't protect. Some protect from STDs and some don't. And so we really want to make sure clients are really aware of what the purpose of this condom is and what is the effective rate. There's female condoms. I don't think these are nearly as popular. They're bigger, they're more expensive, they're clumsy. If people are going to do a condom, it tends to be the male condom. And the failure rate is high, and it's not a very popular option. It can be inserted way in advance before sex. You can pick it up over the counter, but it's just not popular nowadays. Spermicide methods can be used solo. They can be used in conjunction with a barrier method, just depending on your comfort level. So spermicides are a chemical. It's a chemical killing the sperm itself, but it has a high failure rate, 21% by itself. People will typically use it with the condoms. You can get spermicide lubricated condoms. You can get the diaphragm and then buy the spermicide. So it's typically used in conjunction with another method. Nothing is ever 100%, but people tend to pick stuff stuff nowadays that are high effective rate, low maintenance, lowest risk possible, and can be cost effective and spontaneous use. So when you're thinking about the risk and benefits to non-hormonal options, relatively speaking, to hormones, to all the other choices that are out there, to the risk of being pregnant again. I mean, too many times we talk about the risk and benefits of the contraception, and especially in our high litigation, people are so fearful. You smoke, you've had a history of strokes, and you've had happening. I don't feel comfortable giving you a hormone option, and you're telling me that's the only thing you can do. What's the risk of them getting pregnant and having a clot and being obese and having a smoker? Like, we have to analyze the risk and benefits of the contraception options on top of what works best for her and what's the risk if she gets pregnant again and she doesn't want to and she has health risk. Like, we have to consider the bigger picture. So there's different side effects for different people. There's goods and bads of every option. Some people do well with hormones, some people don't do well with the Paragard, some people love condoms, some people hate condoms, some people like taking a pill, some people don't, some people love their diaphragm, and some people like the withdrawal method because they've got a partner that can really control it, even though there's a little bit with pre-ejaculation they're okay with. Like, the list goes on and on and on. So you need to have a good discussion with your client and her lifestyle, her needs. She's got a crazy life, so taking something every day doesn't make sense. Condoms break all the time. She has a latex allergy. They want to be spontaneous and they can't do that because they ran out of condoms. Like, you have to list all these things if you're talking natural family planning, but they don't know how to understand their body and basal body temperature and cervical mucus and that 3 to 5 day window, and they have regular cycles or they're irregular. You have to really have good discussions with them on sexually transmitted infections, risk of pregnancy, the potential complications, the pros and cons of every single option, and what makes the most sense for them. So just really thinking about, there are so many amazing options out there for contraceptions if families want to use them. Some families love having lots of babies. They're religious, they love kids, they had a hard time getting pregnant. They're just grateful if they get pregnant again. Like, there's, everybody's situation's different, but don't make assumptions. So when you're discussing, you just start high level. Do you want birth control or do you want to have another baby again? Breastfeeding is a great natural family planning space if you use it appropriately. It's 99% effective the first 6 months if you exclusively breastfeed and the baby eats every 2 to 3 hours. So you have to have a discussion. You can totally do natural family planning, and this is the education, these are the resources, these are the barrier methods, these are the hormone options, these are the sterilization options, these are the withdrawals, the barriers. So families tend to get overwhelmed, but if you just break it up instead of listing every single possible birth control they can have, learn what they've used before, why did they like it, why did they not like it, their age, their finances, how responsible, how low maintenance, how spontaneous can they use it, what is their beliefs, how badly do they not want another kid. If they're telling you they 100%, 120% do not want another kid, you may talk about a really, really effective option or sterilization. So we really need to make a think about who we're serving, where we're serving, what they would like in their life, what their family dynamics, their culture, their needs are for their birth control option.